I like to think that after spending a few years writing about politics and policy, and after having worked for Bernie Sanders as his lead writer on the presidential campaign, that I know the real thing when I see it. I believe that our next guest is the real thing, but we will talk about it. Abdullah Syed is a candidate for governor of Michigan. He is a physician, a doctor. He has been the executive director of the Detroit Health Department and the health officer for the city of Detroit, and he is running for governor on what I consider to be a very strong and very solid, genuinely progressive platform. But he will talk to us about all that and more now, we hope. So first of all, Abdullah Syed, thank you for coming on the program.
Thanks for having me, RJ. This is a fantastic opportunity to chat with you. I really look forward to a great conversation about where we're going in progressive politics and what we can do in Michigan to lead.
Well, and we could talk about that in any number of areas, but let's start with this. Healthcare. It seems to be an obvious point of where we begin. I have a background in health policy and economics. You, of course, are a physician. You were the chief health officer for the city of Detroit. Your state of Michigan has a number of health challenges that it's facing right now, perhaps the best known of which is the tragic, disastrous water problem in Flint. Let's start with this. What led you to pivot from being the chief health officer of Detroit to running for governor?
I've always believed that the responsibility that we have in government is to provide the means of having the best, most dignified life that we can imagine in the richest, most powerful country in the world. And my work led me after medical school to realizing that I didn't want to be a part of a largely corrupted business of healthcare. I wanted to be a part of being able to build that means. And so I started out my career as an epidemiologist and a professor studying health disparities. Wanted to understand why it was that you can drive something like 30 minutes between the suburban town that I grew up in and the heart of the city of Detroit and drive 10 years difference in life expectancy. And then I realized that the academic world didn't quite offer the ability to get my hands on something and do something about the set of problems that I was so focused on. And so decided to take the opportunity to rebuild Detroit's health department when I was offered that role. I walked into a department that had been shut down when our city went bankrupt. When the state took over its finances, a 185-year-old health department shut down in a city with a higher infant mortality rate than my father's native Egypt, higher asthma hospitalization rate, threefold the rest of the state, and quadruple the probability of lead exposure in the city of Detroit. And I was hired to rebuild that health department. In my role there, we were really focused on providing basic goods and services, and then also thinking outside the box, providing children a free pair of glasses so that they could see the blackboard, standing up against some of the biggest polluters in the state, forcing them to invest their own money to reduce their emissions while they had been poisoning the city for so long, and then making sure that our schools were safe in the aftermath of Flint by having all of them tested for lead in the water. But I'm here rebuilding a health department that was shut down when our state took over Detroit's finances, watching as the same emergency managers who had taken over the city's finances and destroyed our health department were now poisoning 9,000 kids who looked a lot like the kids I was trying to serve in the city, in a city that looked a lot like Detroit, and then watching as an individual who is antithetical to the highest values of our country got elected president. And in that moment, had to ask myself what my responsibilities were. And I felt that the best way that I could operate moving forward was to help be a part of setting an agenda that put people's health and well-being first, so that we were never in a position where we're shutting down a major big city health department, poisoning kids in a city like Flint because we're not paying attention to water, and we're really living out our ideals and the agendas that we build for the state.
So in a way, it's kind of a story, Abdullah Syed, of applied epidemiology. If you start to take the logic far enough, you realize that the causes of our various illnesses and inabilities to flourish as a people and as individuals are structural in nature. I mean, is that a fair kind of way to reflect what you've said?
You know, that's exactly right, RJ, is that all the structures that we have created, the ways in which we finance government and who it is gets to control our politics, they tend to have created structures that put those with means above those without them. And that's what leads us to the kind of thinking that ultimately led to Detroit's bankruptcy and the shutdown of a 185-year-old health department, as well as the Flint water crisis. When you put balancing the books ahead of paying attention to the lives of real people, this is what happens. And so I often think about politics as simply an extension of what we do in medicine. If you think about what a good doctor does, it's that they sit down with a patient who's in pain, they ask a set of questions, and they listen first. And then from there, they propose a plan working with that patient to be able to provide them high quality health care. What's missing in our politics is exactly that. We have not listened to people about the challenges that they face in their lives. We have not done the work often of being able to address the real diseases in our politics, which is the buyout of politicians by large corporations who can afford to pay way more into a very broken political system than most people can. And then watching as those folks continuously have decisions made in their best interest rather than the interests of good people. And so our job is to fix that disease, to treat our patient, and to create a more just, more equitable, more sustainable Michigan.
You know, there's so much comes to mind with what you're saying, but one of the things that strikes me is that a lot of the things that our government often does, they're very ideological, but they claim to be neutral. You know, I've written about Detroit, for example, the looting of Detroit, I think was one of my pieces, that somehow, no, this is just what needs to be done because of Detroit's debts and so on, without thinking, well, how did it get those debts? Why are we applying those debts in a certain way? Why are we valuing something that has been bought and sold by speculators, a piece of paper that's held by a financial interest A or B, over the lives of children in Detroit or elsewhere in Michigan? I mean, and what that gets me to then is, okay, if we step away from that, if we stop buying that ideology that kind of privileges certain very special interests above everyone else, how does that reflect in politics and in policy? In other words, is that where a platform like yours comes in? Is that where we start talking about healthcare for all, and not insurance for all necessarily, but healthcare for all? Is that where we start talking about avoiding poisons that are created by polluting industries or whatever? How do we present that broader perspective without being kind of marginalized as those crazy people over there, if you get what I'm driving at?
Yeah, I think it's a really important question. It's a question that frames our work in our campaign quite well. At the end of the day, institutions, they have their own ideals and values. And too often, leaders are bought into those ideals, and they don't see their responsibility as being a part of drawing those institutions to the ideals that we ought to be believing in, but rather they get validated by those same ideals from those same institutions, and then they think they're doing the right thing. And meanwhile, those institutions are moving in the wrong direction with respect to what we all believe in. The beautiful thing about our democracy is the intentionality of being a system of government for people and by people. In a system of government for people and by people, we have to be focusing on people. But the institution has largely been corrupted by voices of those with means rather than the voices of all of us. And so what this is about is asking ourselves how far away we've gotten from the intentions of the institution to begin with, and what it will take for us to refocus on the ideals that all of us believe in. Look, the idea that you can live in the richest, most powerful country in the world and not have basic access to the care you need when you need it without putting your family's financial future in potential ruin, that's an anathema to the ideals of the system. So it's on us to stand up and stand firm for a set of ideals and move those institutions in the directions that they need to go to dignify the ideals that we were meant to be focused on in the first place. And so our campaign doesn't shy away from calling to progressive ideals, because we know that when we put people first, we're all better off. And here's the thing, you talk to bankers and you talk to corporate CEOs, they all know that we're in a lot of ways circling a toilet bowl, particularly in the state of Michigan. Everybody's looking to protect the short term without actually appreciating that the long term is what matters. And in the long term, if we're not empowering people to have the means to be able to be a part of the economy because they've got a fair minimum wage, because they've got access to quality jobs, because the institutions around them empower them and take big picture challenges off of their plates like healthcare, Well, that's what the building blocks of our economy are. So if you're not empowering them, you will soon realize that in the end, the economy that you built has nothing to stand on. And instead, what we're saying is, look, if you invest in people and give them high quality educations, you invest in the infrastructure that they need to be able to live their lives and move themselves, their ideas, their goods and services around, and you're able to empower them by providing a basic access to a set of goods like healthcare, what you'll find is that they will go on and do and be in the world, and they'll create real value. That's what the economy is in the first place. And so it's about rethinking the institutional biases and thinking about what it is at core that we ought to be doing, and then identifying the policies that get that done and driving it forward in that direction. And it takes leadership to be able to do that. I'm so thankful for the leadership of Senator Sanders and others in the progressive movement who have demonstrated what's possible when you just stand up and be honest about the challenge that we face and you lead in that direction.
So let's talk about one of those examples that you mentioned, Abdullah Syed. Let's talk about healthcare. In your platform, you say that you support healthcare for everyone, implement state-level single-payer healthcare. How do you do that? By the way, I'm a Medicare for all guy all the way after having studied that issue for a long time. How could you pull that off in a state like Michigan? Would you be talking about making Medicaid available to everyone? How would that work in your thinking?
So RJ, let me just frame the issue here for a second. So for my offices, you can walk just a couple of yards and see Canada. And in Canada, every single resident has access to the healthcare that they need in terms of preventive primary care, tertiary care, quaternary care, even when they need it. That's residents, not just citizens, residents. They provide healthcare at 60% the cost of what we pay in the United States. And they live about a year and a half longer than we do. So by every single metric that anybody wants to focus on, they provide better healthcare in Canada than we do. They have what's called a single payer system. What does that mean? Instead of having multiple insurance companies that insure people, they have one large insurer that's government owned and operated. And what it does is sets the standard for what reimbursements for healthcare are going to look like. And in doing that, it can reduce the overall cost of healthcare while providing healthcare for everybody because you don't have to deal with the multiple overheads and the multiple profit margins that all of these other insurance companies in our current system are profiteering off of. Everybody has better care, they live longer lives, it costs us substantially less. So how do we do that in Michigan? Well, the idea is we would be able to empower a system through state government that would take the cost of providing healthcare off of employers and off of individuals and instead be able to reap the overall benefits of taking out that profit margin and taking out that overhead and deliver care for substantially less. And what it would show up as is a business tax and an individual tax. Now, here's why it works. Michigan knows well the cost of private health care on our industries, right? When you talk to employers, they pay 25 cents on the dollar for every dollar that they pay their employees in earnings to provide them health care. Now, those employees aren't usually all that happy with their health care because they have to fight tooth and nail to get anything reimbursed in the first place. So they're paying for a service they don't like. And so what we would do is say, listen, everybody gets covered. We spend substantially less over time than you're spending right now in providing a substandard service. And ultimately, everybody's happier, it's less expensive, and everybody gets care. In Michigan in 2008, when GM was facing bankruptcy and had to get bailed out by the federal government, they were spending 15 cents on the dollar, not just for employee healthcare, but for retiree healthcare. And you know where they offshored a lot of their jobs ultimately? To Canada. And so people know that this is the right thing to do. It's about being able to get everybody together in a room and say, this could be so much more efficient and effective if we were able to get these industries that have profiteered off of people's health for far too long into a position where they're no longer necessary to provide that service. And when you talk to individuals, you talk to employees, you talk to employers, everybody sees that as the case. And so part of that means that we have to build belief in government again, in the bureaucracy to be able to deliver high quality service. And then part of that is to be able to have conversations with people across the state about why this is in our collective best interest and why we could do it so much better if we were willing to think forward about what's possible.
Well, and there are a million things I would love to ask you about that we can't get to right now. Maybe at some point you'll come back, but I'll leave with, I hope you will, but I'll leave with this question. You are running for governor. You do not accept corporate money, as I understand it. So how's that working out for you, and where can people go to find out more and or contribute themselves?
RJ, I'll tell you, we have been so fortunate to receive over 8,500 individual contributions. We've raised over $2 million to support this campaign. What Senator Sanders showed is that when you're willing to make an honest assessment of the state of affairs in government, you're willing to play by a different set of rules that doesn't force you to take those corporate bribes, donations, and then be beholden to these huge corporations that have dictated our policy for so long, and you're willing to be honest about what your plans are to get things done to solve the set of challenges that have held people back in our state for so long, people come together and are willing to support you. If folks are excited about what we're talking about building a Michigan that's more just, more equitable, more sustainable, about a progressive vision for what our state could look like, I do hope that they'll support us. They can go online at abdulformichigan.com/donate. Also, you can get involved. We're hosting a live stream on February 18th, and that live stream will kick off our organizing efforts. We are organizing across the state. We've inspired more than 2,500 people to be a part of this movement, and we've knocked on over 100,000 doors already. We hope to get to 1 million. And so please do be a part of it. I hope that you'll come. You'll empower us with your time, with your resources, with your network. We got to get it done, but we can only do it together. And that means all of us coming together around a vision for Michigan that puts us all before it puts the folks who have called the shots for far too long.
Well, I never imitate my former boss because I'm not very good at it, but in my view, you're the real deal. So I wish you the very best of luck, Abdullah Syed, candidate for governor in Michigan. Thanks for coming on the program, and good luck to you in your campaign.
RJ, thanks for having me. I really appreciate the opportunity to share some time, and it means a lot to me that you'd say that.